Family building comes in many different forms. I'm Dr. Sharon Moyeri, owner and founder of OC Fertility. I want to talk about the different ways that families are created today. There's same-sex couples, there's single mothers by choice, and single fathers by choice. Let's start with same-sex couples. I have a lot of same-sex female couples who are coming in. Oftentimes they might choose a sperm donor and do what's called artificial insemination, or intrauterine insemination is the medical term. They might choose a sperm donor and then go through with either a natural cycle, meaning we just follow their ovulatory cycle and inseminate with sperm, or they might need medications. Alternatively, sometimes they want to do what's called reciprocal IVF, where one partner will donate eggs with a sperm donor through IVF, and then the other partner will carry the pregnancy. So there's many ways to create families. Sometimes the second partner will also want to have biological relationships so that that partner will also donate eggs and the other partner can carry. There's many ways to do it, and it's really personal to whoever and whatever you want to do. When you're making these decisions, you want to plan ahead and think about how many kids you want to have and the source of the sperm donor if you're doing a same-sex female couple, in order to plan how many vials you might have and future family building options. The other alternative is same-sex male couples. Obviously, with the same-sex male couple, you're going to need an egg donor source. And again, choosing the egg donor, sometimes you'll see that the same-sex males want to have paternity on both sides, so you can split the eggs between the two partners, and then you'll have a surrogate potentially sequentially, or you might have two surrogates, one carrying each pregnancy. Again, totally up to the parents as to what they want to do. And incidentally, we call the parents intended parents. So even though they're not the biological parents, they are the intended parents. The other consideration might be single parents. We see a lot more single female parents, maybe not as many single male parents, but it certainly is increasing. Single female parents are using sperm donors, and either they're doing insemination with sperm donor and some intrauterine insemination, or they're opting straight for in vitro. Again, these options are totally personalized and up to what your family building goals are. The cost for these treatments really varies depending on what your goals are. For instance, if you're considering egg donor, there's two routes. The traditional route is through an agency, and that donor would then typically go through an IVF cycle, fresh, and all the eggs that are retrieved from that cycle would be fertilized with either your partner or a sperm donor source. And typically you're getting a lot more eggs from that cycle, but there's pros and cons to using a fresh egg donor. It typically takes a little more time, but you're generally getting more eggs from that. More recently, I'd say over the past 5 to 10 years, we're seeing people use egg banks, meaning a donor has already gone through an IVF cycle and the eggs are frozen in smaller sections. For instance, 6 to 9 eggs typically. You can purchase more than one batch of eggs, but you're generally getting fewer eggs to work with. So you really want to plan ahead and think about, if you're thinking of having multiple children, perhaps you need to purchase multiple batches, but it does end up going quicker, so you typically can start your family sooner if you're going through an egg bank. The cost is going to be less with an egg bank generally, as long as you don't have to do multiple batches. So the egg bank versus the fresh egg donor, pros and cons with either approach, and the costs roughly are going to be somewhere around the 20,000s for an egg bank, up to maybe 40,000 plus for a fresh egg donor cycle, depending again on the specific donor you use and which agency you go with. And then there's always the option for surrogacy, and again, surrogacy varies across states, whether the surrogate has gone through cycles before, and you really want to read between the lines, because surrogacy agencies don't always, present the details, and that's where I always say the devil's in the details. So you want to make sure that you know if the legal fees are included or not, whether there's insurance that's needed to be added on top or not. Currently, it's a little more tricky depending on which state you reside in. It used to be a little bit complicated by state lines, but it's become even more complicated given the reproductive issues in state lines. California tends to be a surrogate-friendly state. New York tends to be more recently a surrogate-friendly state. We do see a lot of people coming to these states to find surrogates, so there is a higher demand, which also means that they tend to be more expensive in those states. Roughly speaking, you should expect to spend at least $100,000 to $140,000 for a surrogate, but again, it depends on how you're finding these surrogates. There are now more people choosing private to do it on their own and not going through an agency necessarily, but you have to be careful in those situations to make sure that you have attorney representation on both sides that are independent from one another, so that both parties, the intended parents and the surrogate, are protected throughout the process, not just during the fertility treatment, but throughout the whole pregnancy and certainly after birth as well. The other concern with surrogacy that you definitely want to be more careful of, especially over the past 5 to 10 years, there's a lot more kind of people getting into the industry, there's a lot more surrogacy out of the country, and there is a lot of fraud in the industry, and so there's definitely concern, and you want to be doing your due diligence to make sure that people aren't being taken advantage of in that situation. So we talked about a lot of things. Family building comes in all different forms. There's, same-sex couples, there's egg donation, surrogacy, and really it comes up to what you want to do with your family. Next step would be to talk to somebody and see what your options are and go from there. So reach out to your reproductive endocrinologist so you can start the conversation.